I'm Amanda. I'm going to demonstrate how to insert an NG tube. So the first thing I would do is check my doctor's orders. It looks like I have an order to hook the patient up to an NG tube for suction. I would gather all my supplies. I'm going to be using this type of tubing because it's not for feedings, it's just for the suction purposes. Have my stethoscope and my pen light. I would walk into the patient's room and perform hand hygiene, introduce myself, check his armband, and make sure that he is aware of what we're doing today. I'm going to let him know that the procedure may be a little bit uncomfortable, but that it's going to help him out. So the first thing, okay, awesome. So the first thing I'm going to do, I have performed hand hygiene. I'm going to check his nares and see if they are patent. And they are. I'm going to have him occlude one nair and breathe through, and vice versa, and see which one has more airflow. And it seems to me that the right one has more airflow, so that's the one we're going to go with. Let's see, I'm going to take my tubing and then measure how far we're going to go. And to measure, going to go from the nose, behind the ear, and then down to the xiphoid process, and then mark it with a piece of tape so you know how far to go. Then I'm going to put on some clean gloves. And then I'm going to lube the distal part of the tubing about 4 inches or so that it's easier to go in. And then I'm going to have the patient tilt his head back and insert it until I meet resistance. Going to check for coiling in the back of the throat at the same time if the patient were to be gagging or coughing, or if the tube were to be coiling in the back of the throat, I would pull it out and start over. I then would give the patient a cup of water so that we could advance it further. I would have him tilt his head to his chest and take a sip of water, and each time he does, advance the tube down. I would advance it down until it got to the tape mark, and then ask the patient to talk, make sure that he's comfortable, and temporarily place it on the side. Right. Okay, and then I would get my stethoscope. I would put in 30 milliliters of air. Pick it up and then listen for a whooshing sound to make sure it's in the appropriate area. Okay, and I hear a whooshing sound, so I'm going to draw back just a little bit to check the pH. Disconnect and put that on a piece of pH testing paper, and I would want it to be less than 4 or whatever the hospital's protocol is. I would then make sure that this is like that. Like this. And hook it on the bridge of the nose so that it stays in place. It's not going to work. And then I would safety pin the rest to the patient's gown so that it doesn't get caught on anything. Okay. And then I would hook this up to what the doctor ordered, which is low intermittent suction. I would then dispose of my dirty gloves and document on the MAR the color and consistency of the contents, the time that I put the NG tube in, the amount that I put in and pulled out, the length remaining of